Good day everyone, I'm Meljude D, Bocobo, student nurse from Nueva Ecija University of Science and Technology, BSN 3C. And for today's video, we're going to perform administering oxygen by mask. And for our goal, the patient exhibits an oxygen saturation level within acceptable parameters. Next, equipment, check for oxygen delivery devices as ordered by healthcare provider. And then oxygen tubing, considered extension tubing, humidifier if indicated, sterile water for humidifier, oxygen source, oxygen flow meter, and appropriate room sign. For our implementation, bring necessary equipment to the bedside stand or overbed table. And then next, perform hand hygiene and put PPE if indicated. Then next, identify the patient. So, good day ma'am, my name is Meljude D, your student nurse for today. May I know your name ma'am?
I'm Meljude D. Bocobo.
How old are you po?
20 years old.
Okay ma'am. And then next, close the curtains around bed and close the door to the room if possible. And then next, explain what are you going to do and the reason for doing it to the patient. So good day ma'am, today I'm going to administer oxygen by mask. It is important because it can maintain adequate tissue oxygenation while minimizing cardiopulmonary work, and also to deliver oxygen to people who don't otherwise get enough of it. And lastly, provide relief to people with respiratory disorder. Is that okay with you ma'am? Okay po. Review safety precautions necessary when oxygen in use. Place no smoking signs in appropriate area. And then next, attach face mask to oxygen source with humidification if appropriate for the specific mask. And then start the flow of the oxygen at the specific rate. For a mask with the server, be sure to allow oxygen to fill the bag before proceeding to the next procedure. And then next, position the face mask over the patient's nose and mouth. As you can see, ito yung panglagay sa nose. So ma'am, paki-close po yung mouth. Then adjust the elastic strap so that the mask fit is snugly but comfortable on the piece.
Ma'am, try niyo pong huminga gamit ng ilong, then close po natin yung mouth.
Ma'am, hindi naman po ba masyadong masikip?
Hindi naman po.
Or adjust pa po natin?
Okay na po ma'am.
And then adjust the flow rate to the prescribed rate. If the patient reports irritation or redness is noted, use gas pad under the elastic strap at the pressure points to reduce irritation to ears and scalp. Next, reassess patient's respiratory status, including respiratory rate, effort, and lung sounds. Note any signs of respiratory distress such as tachypnea, nasal flaring, use of accessories, muscles, or dyspnea. Next, remove PPE if used and perform hand hygiene. And lastly, document. Next, remove the mask and dry the skin every 2 to 3 hours if oxygen is running continuously. And lastly, do not use powder around the mask.
Ma'am, tanggalin ko na po yung mask.